Hey everyone, Danielle again. Today is Thursday, January 18th. I am currently 6 days post-op. I had my spinal fusion on Friday the 12th. If you have not watched my previous video, I've done a few more videos, but I don't think I uploaded them. So this will be probably just my second video being uploaded. I had a successful anterior and posterior L5-S1 spinal fusion. So they went in from the front and put a spacer in between my vertebrae to put them back in the positions they should be and spaced apart as how they should be. And then flip me over, and from the back they put in rods and screws to keep my vertebrae stable. So instead of those vertebrae wiggling around all crazy and compressing on my nerves, it should now stay stable. And I just wanted to give an update for anybody that is considering this surgery. I am 34 years old. I will be 35 in 2 weeks. I did not have an injury. This was all genetics. I have what is called bilateral pars defect, which in layman's terms is a fracture at my L5-S1. Again, like I said, this is genetics. I did not have an injury. I didn't do anything to create this. It's just weak bones. Degeneration set in faster than normal. And this is the result of that. I also birthed both of my children at home with no epidurals, no pain medication. I wouldn't say, I definitely haven't been a gymnast, but I was always into, doing backflips all the time, jumping on trampolines, doing stuff like that. So I don't know if just like a combination of all of that throughout my life exacerbated the problem. After having both of my babies, my youngest, gosh, I had her in 2013. So she will be 5 in April. I got to stay home with them for 3 years, and then I went back to work, which is a desk job, doing computer work and whatnot. So I have a feeling that, that definitely contributed to my problem. I want to say it was within a year of being back at a desk job that I started having back pain, which I've always been prone to, especially when it came time to my monthly periods. But doctors always shrugged it off as, oh, that's just back pain, normal, everything, it's normal, women deal with it, blah, blah, blah. Not normal. What I dealt with was not normal. I would be in the fetal position, bawling, since as long as I can remember. So I started, with x-rays, and that's actually how they found the pars defect. And then they did MRIs, found, more. They see the nerves and whatnot when they do MRIs. So it became very apparent why I was having so much pain, and the pain just got worse and worse. I chose not to ever take narcotic pain medications. I did, however, take tramadol, which unfortunately became a daily and multiple times a day thing I had to do, basically to live, to cope with life. I have been working the whole time. Like I said, I have 2 small kids. Both of my girls are 4.5 and 5.5. So I'm busy. I am on the go all the time. I work full time. Trying to think, I believe it was early 2000, like February of 2016. Sorry, I do not have a fancy selfie stick or whatever those things are called to hold my phone. So I am doing this by hand, and I'm starting to get shaky. So I apologize for those of you that are watching this. I started seeking medical help for this, or at least just kind of exploring what the heck was going on, about February of 2016. That's when I found out the pars defect. The MRI showed more. I went to UCSF, had, saw a neurosurgeon by them. He recommended the surgery that I just recently had done. I wasn't super confident or comfortable with that surgeon. So I got a second opinion. I put that off for almost a year. Being so young, I was not ready to face the reality of surgery. I did not want to have back surgery at such a young age. My father, amongst a number of other people, have had very negative results of a spine surgery. So it was a last resort as far as I was concerned. So I did lots of physical therapy, months of it. I started with the chiropractor, did the home exercises, TENS unit, pain injections, which I only did once because it gave me the gnarliest headache. And I'm prone to headaches and migraines. So for me to say it gave me a super gnarly headache for multiple days, there was no way in hell I was giving that a chance again. And that was one thing the UCSF neurosurgeon was kind of adamant about before he did surgery. He really wanted me to try this other, I forget what the injection's called at this point. Doesn't matter. I wasn't going to go through with it. My family is a very holistic, organic, alternative medicine family. So for me to come to terms with the fact of having to take pain medication just to live daily life, that was hard. That was a really hard decision for me to make. But I have a family to support, and I wanted to be able to function every day. So I bit the bullet and I took the pain medication. Again, the most I would take was Tramadol. Yes, it is a pain medication. No, it is not a narcotic. That is a big fear of mine, is, already having this spine disease. Hi, baby. I didn't want to have to deal with an opioid addiction on top of that. I know what a problem that is, currently has been. So that was the last thing I wanted to do, was be taking narcotic medications every day. And I'm glad I made that choice. I am obviously taking them now post-op. You don't really have a choice with the pain that you go through after spine surgery. So I'm just sticking to the regimen that I was given by the spine surgeon. And I'm hoping to not have to take them for an extended period of time. My body will let me know when I can start, decreasing things, and I'm very good at listening to my body. But I want to get back to the actual surgery. For those of you that are possibly facing this or considering it, I will be brutally honest in this video. I was terrified, absolutely terrified. I cried at night thinking of the fact of having to do this. I was terrified I wouldn't wake up from the surgery, from the anesthesia. I was terrified that the surgeon wouldn't have steady hands and would paralyze me. You name it, I was terrified of it. Again, I have a family to support. I have a significant other, so it's not like I'm a single mom supporting my children by any means, but I play a huge role as the mom in my family. So this was a really big deal. This weighed heavy, heavy, heavy on me. Like I said, I want to say I saw the UCSF spine surgeon. It was in 2016, maybe springish, just before summer or so. So that's when the first recommendation of surgery. And I just barely had my surgery January 12th of 2018. So you can see how long I put this off. My first thought about the spine surgery was, oh, I'm still functioning. I'm still able to do, my job and take care of my kids and do my household chores, go to work every day, with a little bit of pain medication. In the beginning, it was only, 1 to 3 Tramadol a day or something like that, as needed. So I not that I shrugged it off, but it was, my thought about it was, there's no rush to get it. I'm going to put it off until I just can't anymore. The more I talked with my significant other, my husband, the more we really came to the conclusion that nerve damage is permanent. That is the one thing that doctors cannot reverse. So that is what started really weighing heavy on me, in addition to the pain increasing. I kept having to increase my tramadol dosage. How many and how often I was taking, I don't want to disclose that because I'm just not going to. Everybody's different. Everybody tolerates pain different. Like I said, I birthed 2 children at home with no pain medicine, so I would like to think I have a pretty high tolerance for pain, but, you know, every pain in your body is different. I mean, teeth pain's the worst, honestly. I would almost rather give birth again at home than have teeth pain. So there's that. Sorry, I feel like I keep trailing off, but there's so much going on in my head about this surgery. So I, I kept going on, and the pain kept increasing. And I finally came to the conclusion in 2017, don't remember exactly when, and I was like, you know what, I want a second opinion. I did a little bit of research, and I found a doctor by the name of Dr. Christian Athanasius through Santa Rosa Orthopedics. I am in Northern California, Humboldt County to be exact, so I am way up in California. I live in a very rural area, so our resources for medical specialty is super limited. We do have a neurosurgery office. However, it it takes anywhere from 6 to 8 months to get in to see them. And then they actually decline a lot of people until, because they're only one practice, they are so impacted with patients. My assumption is they can only take the most severe cases, because there's follow-up and there's, it's not just, you just operate on somebody. It's not that simple. You have to have a consultation. Sometimes people have multiple consultations or multiple appointments before they decide on surgery. Most neurosurgeons are going to want to make sure you did every conservative treatment possible before they'll even consider operating on you. And I don't blame them. I feel that everybody should try every other conservative option, unless you're to the point of can't walk, your legs don't work, one or the other, you can't control bowel or bladder. Those are emergency situations where you don't really have a choice anymore. You're having the surgery and you're having it now. Fortunately, I did not get to that point. I did get to the point of constant pain. I mean, I was in pain 24/7. It just varied in severity. I would wake up in pain. The pain would wake me up sometimes in the middle of the night. I never fell. Well, I should say I lost my balance once, giving my daughter a hug while I was kind of in a squatting position, fell backwards onto my back, which was one of the worst things that could have happened. Fortunately, I don't think I did any extra damage, but it hurt pretty bad for a few days after that. That was the only fall I had. I've heard of things being a lot worse for other people, so I feel, considering what I've been through, I have been somewhat fortunate that it's not as severe of a case of a lot of other people. My symptoms were low back pain. The leg pain was the worst. The nerve pain in my left leg was the absolute worst. It went from the butt cheek all the way down to the foot. My toes would go numb all the time. There would be the tingling, when your foot goes to sleep and then it's waking back up, like that. No, it would kind of be a variation of going to sleep and tingling, just kind of like that, which would freak me out because, I would start getting paranoid, oh crap, here we go, I'm going numb, I'm gonna lose function of my foot or my leg or something. So the more that the symptoms got the more and more severe the symptoms got, and constant, it became very apparent to me that I didn't really have a choice anymore. I wanted my quality of life back. So let's, enough of my backstory. Fast forward to surgery. So I went in January 12th, which was last Friday. I had my, sorry, my kids are getting a little loud in the next room, trying to pay attention. I had my spinal fusion. My husband and I did research prior to this. My husband, bless his heart, he's amazing. He did way more research than I did. He watched a ton of YouTube videos of other people with similar symptoms and having gone through the surgery that I was about to go through. And a lot of them actually reported waking up with the nerve pain in their leg gone. So I was super, super hopeful that that was going to be the case for me. I wasn't expecting it. I have learned in life at my age not to expect things. I was just hopeful. When I woke up from surgery, the nerve pain was not gone. So I just want to let anybody out there that is considering the surgery and you are also dealing with a lot of nerve pain in your leg, don't expect it to be gone when you wake up. That doesn't mean it won't go away, because I am now 6 days post-op and every day it has diminished a little more. It is not completely gone at this point. I, again, do not have the expectation for it to be gone at all. I am just trying to be optimistic, trying to stay optimistic that it will go away and stay away. Sorry, I got to adjust here. My arms are getting tired. So I woke up from the surgery, excruciating pain. I am not going to sugarcoat this, guys. The pain at the surgical site from the hardware in my back, oh my gosh, excruciating. They could not get my pain under control either. I had the nerve pain going on, so that made me just want to move, which I just had spine surgery. I can't move around a bunch. So I basically just kind of laid there in tears, and they, you know, would give me some IV medication that would kind of help calm me, but it didn't really take the pain away, unfortunately. I don't know exactly how long it was, like how many hours. I don't feel like it was that long after I was out of spine surgery that physical therapy came to visit me. You know, and they kind of wanted to do a few things. They definitely wanted to get me up on my feet, walking if I could. I am, if anybody is into astrology, I'm an Aquarius. Super, super overly independent. I do everything myself. I don't ask for help. Not saying it's a good thing. Not saying it's a good trait or a good quality. That's who I am. Drives my husband insane, but it is, I am who I am. So when physical therapy came in, they kind of, you know, can you feel this? Can you feel that? Move this, move that. I could do all of that, fortunately. They asked what my pain level was. I said, I'm a 10 out of a 10. And they were like, wow, okay, so we probably shouldn't try anything. They still gave me the option to get up and try to walk. Being my stubborn and overly optimistic self, I was like, sure, let's give this a go. Not sure that was a good idea, but at least I showed and proved to myself that I could do it. I got out of bed. That hurt because I have an anterior and posterior incision. So you do a log roll, but you still are using some of your stomach muscles to help you get up. I mean, you push with your arm. You're supposed to just be using your arms and everything to push you up, but excuse me, your stomach muscles still get used somewhat. So that hurt. That hurt very bad. I still did it. Sat up, took a few deep breaths, stood on my feet. My gosh, that was excruciatingly painful too. They asked me, "Are you sure you want to try this?" Again, me, Miss Independent, Miss I can do everything. I was like, "Sure, let's try this." I took 2 to 3 shuffle steps. I'm not even going to call them regular steps. Baby steps, will you? There are more shuffle steps. And didn't even make it out of my room. Made it, you know, like I said, 2 to 3 steps away from my bed. And I was like, okay, getting really lightheaded, feeling really nauseous. I'm going to need to sit back down. So got me laid back down. I was already at a 10 out of a 10. So that just spiked my pain level way high, like skyrocketed. I'm in tears again. I'm an emotional person, so I have no problem crying. I wouldn't say I'm a cry baby, so don't get carried away there, people. But I'm an emotional person, and when I hurt, I'm gonna cry. You're gonna know that I'm hurting. So I believe that's when they eventually tried the IV morphine. That worked the first time. I slept. I actually got to sleep for, I don't even know. My time frames are so off since this surgery. I'm going to guess I slept for, 2 hours or so. Woke up in pain still. The pain, the first day, out of this world, excruciating. I almost can't even put into words how bad the pain was. Please do not, do not let that deter you. If you are really considering this surgery, it's temporary, it's temporary. It passes. It took them just about 2 days. Two days? Let's see. Had my surgery Friday, and I got to go home Sunday afternoon. So it took just about 2 days, yeah, for them to get my pain under control. Couldn't sleep through the night. The nurses come in and they give you your pain medication, on time. I want to say it's every 4 hours I was on. And then they'll give you IV pain meds for breakthrough pain. It seemed like I was having more breakthrough pain than I was regular pain because the pain was just so constant and excruciating. I got extremely, extremely discouraged because they could not get my pain under control, which meant I couldn't go home. That was the main thing. If they could not get my pain under control and I couldn't walk, I wasn't going home. And I had my 2 little girls waiting at home for me. And let's face it, who wants to be living in a hospital? And I was also somewhat given the false hope that I would only be there one night and get to go home the next day as long as all went well. As far as I was concerned, everything went well. The surgery went well. The surgery was a success. It was my pain that wasn't going well. So, I'm not going to lie. There were times where I got really discouraged. I cried a lot. I got down on myself because I wasn't making the progress that I thought I would. However, on Saturday, let's see. So it was, I want to say like Saturday afternoonish. By that point, they had given me a few doses of the IV morphine, along with my oral medication. I'm sorry. Sorry, let me backtrack. I'm jumping all around and I apologize. It got to a point where the morphine actually wasn't working. So a nurse suggested IV Dilaudid. This is my first major surgery. I work in the medical field, so I'm familiar with these terms of these medications. I've never had them. I have no idea how it's going to affect my body. Fortunately, I don't have any allergies that I know of to any pain medications, so we tried Dilaudid. That worked amazing for me. I was able to sleep, sorry. I've been on my feet a little, way too much today, so I just wanted to get this video in before I lay down and probably take a nap or go to sleep for the night. So we are at, let's see, Saturday afternoon, having a lot of pain again, and they're like, okay, it's pain med time. So they gave me my oral meds, And because the oral meds weren't really controlling the pain still at this point, they gave me the IV Dilaudid. I was feeling very calm and relaxed. My room, they turned all the lights off in my room, and I was ready for a nap. I was basically just about closing my eyes, ready to go to sleep. And here comes physical therapy. Not sure why it took them so long, because at this point, it's literally like 4:30 in the afternoon. They were not supposed to take that long to get to me. However, I am not the only patient in the hospital, so not that I could be super upset at that. So physical therapy comes in, and they basically let me know this was my only chance today to get up and walk, or at least try to walk. And me knowing that my walking was one of the things dependent on me going home, you best believe I was getting up and trying to walk, no matter how tired I was. And I even asked them, I was like, I just took all my pain meds. I'm ready to take a nap. Are you sure that this is like a safe idea for me to be walking? And they were like, oh, sure. You know, it will help because it's, you know, going to mask the pain. So it'll make it easier. Not sure that was actually the safest idea. I did not fall or anything. The problem is physical therapy pushed me way too far. It was a huge improvement, don't get me wrong. I walked to the bathroom, which was great. Improvement, again. And then I did a whole lap around my recovery floor. Not like a quarter or a third, like a whole lap. I had even asked the physical therapist, oh, can we just go to the nurse's station? Like, can we just turn here and then go back to my room? And she's like, oh, no, we're going down there to, like, let's just say the next block. I'm like, okay. And keep in mind, I have all of my pain meds pumped in me, so I'm feeling good. I'm like, sure, I'm freaking Wonder Woman. Let's do this. So I did it. I accomplished that lap. Wow. Talk about going right back to excruciating pain as soon as I got back into bed. And I was totally kicking myself in the ass for that. Again, I couldn't have pain meds because I had just had them all, which pissed me off. Because now it was like, yay, super accomplishment for me. Boo-hoo. Now it was like all the pain meds wore off because I just walked around the whole floor and couldn't have anything else. I had to wait my 4 hours, or I'm pretty sure it was 4 hours. They might have made not an exception, but they might have called the hospitalist and explained the situation and been like, is there anything that we can give this person? Because she's like dying of pain right now. So I was finally able to, let me backtrack a little bit. The shift change was coming on, and I had to stay another night, which I was not happy about at all. However, my favorite nurse was coming on that shift. She had told me the night before, or she had told me that morning when she left, because she was the night shift nurse, that, you know, pleasure to meet you, likewise. However, I hope not to see you again, but if I do, you know, it'll be cool. Or great. So I was bummed I was staying another night, but the only thing I was happy about is I got my favorite nurse again. She was a little more on the holistic kick. She was a massage therapist before becoming a nurse. Super attentive, super compassionate, super empathetic. Just there for her patients. She was absolutely amazing. I cannot say enough positive things about this person. I don't want to name names. I've already said the hospital I was staying at and everything. I don't want to put anybody out there that doesn't want to be out there. She knows who she is. So, you know, I let her know my concerns. The fact that they kept having to give me IV pain meds was really discouraging me, because to me, that was telling me I wasn't going home anytime soon. If I couldn't only be on oral pain meds, I wasn't going anywhere. So that was really, really discouraging me and upsetting me. I wanted to go home. So I explained my concerns to her, and she said, or she explained that, that's not really the only deciding factor. The surgeon and physical therapy has a lot to say with this. So, I don't remember 100%, but I'm not sure that I actually even had to have IV pain meds that night. I maybe had to have it like when she first came on her shift at like 6 or 7. But for the rest of the night, she just woke me up every 4 hours for my oral pain meds, would ask how I was doing, my pain level. The hospitalist and my surgeon, they had approved more IV pain meds if I needed them, and I declined. Not that I was trying to be like the tough chick sticking it out. It was just more like, I need to see if I can handle this, and if I can't, then I'll take it. But if I can handle it, then let's move forward here. Fortunately, I had a good night. In the middle of the night when she had woken me one of the times, I just, that was when I just kind of had, I wouldn't say a heart-to-heart, but just, nurse to patient, like, these are my concerns. And she comforted me, and she made me feel a little more positive about the situation. My husband was starting to kind of stress me out at this point, because they weren't trying different medications. They were just giving me the same thing. So he was getting a little frustrated that, we were going to be there for more days. And are you guys going to even be able to keep her? Like, are you going to be able to even control her pain at this point? Because it doesn't seem like you're able to do that. So that was kind of stressing me out. And so when this specific nurse had come in the middle of the night, and I somewhat confided in her, and, she kind of put me at ease a little bit that it would be okay if I needed the IV meds, just to let her know she would get it. Other than that, I was doing great. I was making improvements, and to stop getting down on myself. Everybody's different. Everybody, not one patient has the same pain regimen. Not one patient. They may try the same things, but I've actually watched a lot of videos where people are like, they've given me Percocet from the get-go. Never had any IV pain meds. I've never had Percocet. They never gave it to me. So everybody's different. Everybody handles their pain different. Everybody handles pain meds different. My video, I just realized, is over a half hour, so I will wrap this up. I want to give a very realistic experience for anybody that is considering this surgery or knows that they have to have this surgery. So we are now to Sunday.